I'm Bob Cusack, Editor-in-Chief of The Hill. Thank you for joining us for our program today, Cancer Care Access and Equity, Breaking Barriers to Innovation. And thank you to City of Hope for their support of today's program. We live in a groundbreaking era of innovation in oncology, yet cancer continues to be the second leading cause of death in the United States. According to the American Cancer Society, there will be over 1.9 million new cancer diagnoses this year and over 600,000 deaths. In addition, cancer costs the United States a hefty $208 billion each year. Many patients are not able to access the benefits of cancer innovations, and too many people, particularly those from historically underserved communities, are without the care they need to survive. To combat the impact of cancer, federal health officials recently introduced initiatives such as the Cancer Moonshot Plan, which aims to cut the cancer death rate in half within 25 years. What obstacles stand in the way of optimal cancer care? How can we increase cancer screenings, advance research, modernize detection and treatment systems, and drive innovations while removing barriers to access and affordability? What role do social determinants of health, like geography and race, play in keeping patients from specialized, life-saving care? And how do we eliminate these disparities? Well, we have an outstanding group of guests joining us this afternoon. But before we get underway, just a reminder that you can tweet us at The Hill Events using the hashtag #TheHillCancerCare. Joining us now is Representative Mike Kelly of Pennsylvania, co-chair of the Cancer Caucus. He is aiming to increase funding for cancer research. Welcome, Congressman.
Oh, Bob, thank you. Thanks so much for having me. I appreciate this.
So obviously, just want to get to the news of the day, news of the month, and we have the debt ceiling deal. Is this going to jeopardize any cancer funding?
No, I don't see any reason why it would jeopardize that at all. I think, after this drama that we saw a week ago, and to be very candid about this, since I've been here for 12 years, every time I hear somebody say, this is the most important vote you'll ever take in your time here, and I say, you're right, until next week, then there'll be another one. But the most important vote of all is the vote we cast when it comes to fighting cancer, and especially when I look at the most important asset that our country has, because we know that 25% of our population is our youth, but they're 100% of our future. And so if we can't protect our future, there's no sense in being here. These other votes are important, but funding alone is the key to winning this battle against this incredible disease that affects children. And just being the people we are, the most vulnerable are the ones that need the most protection. So I just think that on this, it's always been a natural for me. I've got 4 children. They're all grown now, but I've got 10 grandchildren. And wow. I think there's not a parent out there or a grandma, grandpa, and uncle who just fears the thought of somebody getting that message that your child has cancer, your grandchild has cancer, your granddaughter, your grandson, your niece, your nephew. I mean, it's just so elementary to who it is we are as people. We always want to protect the most vulnerable, and we want to make sure we're doing everything to give them a chance at life. So this one to me is not even debatable. This is the easiest vote anybody will take, and this is one of the best spends of our taxpayer dollars that we can have. So I'm just glad to be part of it. I'm glad to be here at a time when we're looking at legislation that's critical, and again, protecting some of the most vulnerable people in our country.
Well, Congressman, we had your colleague Congressman Higgins on from the caucus, and he was talking about some legislative priorities other than funding government agencies to combat cancer. Are there legislative priorities you think could get done between now and the end of the year, or between now and the next election in 2024?
Listen, and I don't want to be casual about this. You can't outlaw cancer. You can't pass a law that's going to say we're done with it. We're not going to have it anymore. We're just going to uproot it and throw it out. No, you can't do that. But you can do is you can guarantee funding for the people who go to work every day. And I have I marvel at this because most people think of doctors as being this upper echelon and the upper earners when you come to being in our economy. These are people that aren't interested in income. They're interested in outcome. They are so concerned and so focused on this battle against cancer that they go to work every day with only one goal, and that is to stamp this out and do everything they can. Now, we know right now that about 80% of children that have cancer get cured. There's another 20% that are there. That 20% is what we're looking at today and saying, listen, we have to keep going. We've got a great start, but we haven't crossed the finish line yet. We may never cross the finish line, but we'll never stop trying to cross the finish line.
You're a big proponent of telehealth, and I remember when I used to cover Medicare and Medicaid many, many years ago, telehealth was coming on the scene, and it, of course, exploded during the pandemic, and the pandemic was tough on a lot of people. But can you talk about the advantages of telehealth going forward now that the pandemic is over?
I would think that if you were to look at most members of Congress, most of them come from areas that are predominantly rural areas. The big cities are the big cities. That's one thing. But a lot of our population is not in the big city. They're in rural areas. Getting to the type of care they need is difficult. Getting a diagnosis is difficult. But if you can go on a screen and get the answers you need to get at a critical time, that oftentimes will turn the ship around and be able to get these people to a cure and not to something else. And I just think that what we've been able to do when it comes to the ability this country has, in fact, the world, of communicating and getting the message out and getting answers to people and getting help to people. Telehealth is one of the biggest things we've done that really eliminate that idea that I'm 3 hours away. I'm a day away. I have to get in an airplane and take whoever it is that needs this help across the country. The telehealth, we can do some things that we couldn't do before. And it's that early detection that is the key to all of this. And so a lot of this takes place right in our own areas where we can actually talk to people in this line of business and they can help.
Mm-hmm. As you know, Congressman, there are a lot of government agencies that deal with healthcare, whether that's CMS or FDA and NIH. And over the years, we saw during the Trump administration the right to try bill, which became law. But still, there's some frustration with whether it's FDA or CMS for coverage issues. What do you think is something that the government agencies really need to get? What you hear from cancer patients across the country, because a lot of them are frustrated that there are some experimental things out there and they don't get access to them.
Yeah, well, I think that's the right to try was based on that. I think the other thing, there's nothing more frustrating, and I don't want to say this critically, but I have to. Listen, there are too many hurdles you have to jump over, too many hoops you have to run through that make it almost impossible to get to the answers you need to get and to get the help you need to get and get the type of diagnosis you need to get. As we said earlier, it's that early detection that puts us in the right direction to finding out what is it that we can do to help early on what some of our folks are going through. So, when I look at all this and you start thinking, there are so many agencies. You look at this alphabet soup when you get into the federal government, and then you can go to the state governments and you get all the whole way down the line. You have to go through agency after agency after agency after agency. And all we're looking for is a yes or a no. Can we help this person? What is it that we have to do to help this person? Can we change the direction that we're going? Why do we have to go through agency after agency after agency, through hearings after hearings after hearings? Some of these things are so simple. If anybody tells me, look, we'll get to your problem once we get clearance from all the agencies, I say, you know what, let's do it differently. Let's get people who were elected, and I love the name, not representative, not congressman, representative. We all represent about 750,000 people. If somebody calls our office and needs help, if I tell them, well, you know what, it's going to be a long time for me to get you an answer because I've got to go through this agency, and this agency, the only thing you get in the other end is that sigh of saying, but Congressman, I can't wait that long. And so it's baffling to me. And listen, there's no other place in the world like this. Mm-hmm. But we need to keep it that way. I don't want to be an also-ran. I don't want to be a country that almost got there. I want us to be the leaders across the board in everything we do. We need to be the envy of the world on what it is we do to protect just a precious asset is our youth. And so we have to work on these things, and we have to be more, and it's not a matter of being bipartisan, it's being a little bit intelligent. We need to be able to jump over some of these hurdles ahead of time rather than waiting. Being in a waiting room is nothing more frustrating. And I would just ask anybody that watches, there's nothing more frustrating to go to a waiting room and you have a child or an adult that needs care right away. And you're so far down the list, you say, you know what, I'll come back later. I don't know that we can wait any longer. And by the way, the issue that we were here for is no longer an issue.
Mm-hmm. I have an audience question for you, and this comes from Emma Tramble, CEO and Chief Engagement Officer, Wiser Strategy, Inc. And Emma asks, out-of-pocket insurance deductible costs cause a great deal of medical debt during cancer treatment. What can legislators do about this issue?
Well, but as what Emma's asking, so out-of-pocket insurance deductibles. So the question is, I don't know what kind of a policy you have. In order to get to a premium maybe that you could afford, you have to go with larger deductibles, right? I mean, it's just a simple, I'm in an automobile business. If you want to keep your payment, your insurance payment done, go with a large deductible. The only problem is sometimes you never have coverage for that you need for the problem that you're trying to cover. I think what we can do with this is the government can step in, but we need to be, it's about transparency, isn't it? It's always going to be about transparency. Mm-hmm. Just be honest with us. Tell us what you can't cover. Don't give me some laundry list of things that I have to do before I can get into the doctor. I don't need that. I need emergency care right now. This isn't a disease that's going to wait to get an approval. What we have to do is make sure that we make it easier for the approval to take place. And I think we can do that legislatively, but a lot of it is done with insurance policies that have high deductibles in order to be affordable. So a lot of people have an insurance card, but really no coverage.
Last question. Cancer is a heavy topic, and it's affected us all, loved ones, scares. I want to end this on a positive note. What are you looking forward to over the next 5 to 10 years? You know, technological advances have been so prevalent, and that obviously is also in the field of cancer research. Give me your viewpoint of where we're going.
Wow, I'll tell you, I'm an automobile dealer. I'm a Hyundai dealer. And this is our 25th year. Hyundai dealers have raised over $225 million to fight childhood cancer. I think what we're looking for more than anything else is an awareness. And I know that there's nothing more devastating than to hear your child has cancer, your niece, your nephew, your granddaughter, your grandson has cancer. But the people that it affects are the people that it affects. There's other people on the sidelines that, geez, so sorry to hear that, so sorry to hear that. Well, the thing is, we all need to be that grandpa, that grandma, that aunt, that uncle, that mother, that father facing this problem. And if we can do that, and then we can push our legislators in office, we can look at everything that's on the table and say, can we please speed this up? President Trump's right to try was about, we have things in place right now. People need the right to try. And a lot of those folks, as you know, were in a terminal situation. So what were they waiting for? If the final answer is it's finality for you, then that's right. Not the answer that we want. And we certainly, if we can't solve this problem in the United States of America, it can't be solved anywhere. And we're willing to share it with the world. Look at what we did with COVID. We found a way to fight COVID, and we shared it with the world. Now we need to find a cure for cancer as much as we can and share it with the world.
At the local level, what are some anecdotes that you think really work in combating childhood cancer?
Yeah, I think when you look at there's different things that take place, and there's different people that are really champions for this. I mentioned earlier, I'm an automobile dealer. I'm a Hyundai dealer. For 25 years, Hyundai Motor America and Hyundai dealers have joined together to fight cancer, to just completely defeat childhood cancer. And what it is a donation for every Hyundai sold. They make a donation to what they call the Hope on Wheels program. This program, well, for me, it's Pittsburgh Children's Hospital. So when you see this, you go to these events. We have a Hyundai there, but then we also have little pie tins with different colors of paint, blue paint, green paint, red paint, yellow paint. And when they see these children, most of them brought out in wheelchairs, and I'm talking about some of them who haven't even been to kindergarten yet. And you see them take their little hand and they put it in this paint and they put it to the side of this vehicle. And it's about the helping hands. How can we all work together to stamp out this horrible, horrible situation and make sure that nobody ever has to hear that your child has cancer again? When you see these little tiny handprints all over this car, you say, you know what? This is something that if it doesn't touch you, nothing will.
Yeah, that is some powerful stuff right there. Congressman, thanks for sharing.
Thank you. I appreciate it.